Our first guest today is Desiree Dunston of Novant Health, Brunswick Medical Center. Welcome to the show today, Desiree.
Thank you very much. I'm so happy to be here.
It's very, very nice to have you. And I understand that you recently joined Novant Health Brunswick Medical Center as Director of Professional and Support Services.
Yes.
That's a big title.
Yes, it is.
And I think it's a big job for you too. Let's start by hearing about yourself. Tell me a little bit about your education.
I received my bachelor's in business administration and marketing from Cheyney University, Pennsylvania, which is about 20 miles outside of Philadelphia. And then I got my master's degree from Pfeiffer University. And that was, they had some satellite campuses out in the Raleigh-Durham area, and that's where I was stationed then.
Great. So let's move on to your work experience. Tell me what you've done and what led you to move to Brunswick County.
I would say for the past 25 years, I spent most of my career in post-acute services.
Really?
And when I say post-acute, it's more of what happens to the patient once they're discharged. You know, going to a lower level of care, home care, hospice, DME, or nursing skilled facilities. And then after that, I just wanted to do something different. Now that I had the post-acute background, I really wanted to get into the acute environment so I could learn the inpatient side of things. And so I started with Novant Health back in January of 2015. So I've been with them a little over a year. And I was doing a similar job and also was managing the Triangle practices, which are owned by Novant Health. There's 4 in the Triangle currently.
And those are physician practices?
Yes.
Great. So how did you like Raleigh? And let's talk a little bit about the Raleigh area. I'm surprised that you would want to move to Brunswick County from the Raleigh area.
Well, the Raleigh area, of course, you know, it's very competitive there.
Sure.
And there's lots of hospitals and physician practices there. But once I became a part of Novant, the environment here was just so welcoming. Everybody loves their jobs. And, you know, Mr. Amato has a mission that everybody is behind and really tries to do their best to push it forward and cascade it down to team members. And I just started hearing so many good things about Novant Health, and I really wanted to make sure that I was able to stay within.
Part of that.
Yes. So when the opportunity came for me to actually be in the same role that I was in, I just jumped to it, and my husband was willing to come down, and here we are.
So you both love the area?
Yes.
It's a great place to live. It's just a great way of life. Would you agree?
Absolutely, and the people are just so welcoming here.
I think the people in Brunswick County are very welcoming. I think it's there's a lot of locals around, and I love the locals, but I've never felt like an outsider. They've never made me feel that way, so I just love it here.
Yeah, so do I.
Well, we sure are happy to have you. We're just really glad that you're here. So let's talk about your role at the hospital. Now, I know you have a very long title, and so let's talk about what that means.
Currently, I manage most of the departments in the hospital except nursing and physician services. So that includes environmental safety, plant engineering, public safety, food and nutrition services, respiratory therapy, radiology, and laboratory services, and the physical rehabilitation departments.
How did you remember all that?
Well, again, that was a similar role that I was in when I first started. So it's the same departments, and actually in supply chain. I did just inherit supply chain.
Oh,
so, yes.
One more. So in your role, what role do you play within those departments?
I actually support all of those departments. They have a dotted line to me. We have service line leaders within Novant Health System that are their direct reports, but I'm like the manager at the hospital on site for them to come to, and if we need to talk about any improvements or opportunities to make changes, I'm here to help them.
Okay. And when did you start at Novant Health Brunswick Medical Center?
March 14th.
March 14th. Okay, good. So let's talk a little bit more in depth about the departments that you're going to be overseeing. So do you have specific goals in mind for these departments or yourself? Let's talk a little bit about that.
My goal for the first 30 days was really for me to become familiar with the department functions and to build relationships with my managers and team members. So I meet with my managers once a week, and we talk about things that are going on, and we talk about team members, and I actually attend their staff meetings, regardless of what time of the day it is. And most of the time you have to do them either early in the morning or in the evening. So that was my plan, is just to really wrap my arms around the departments that I manage and build those relationships.
Well, and then that gives you the opportunity to learn all of the people who report to that manager. Is that correct? That they're all in that staff meeting?
Yes.
So it really gives you a good idea of what's going on within the facility in terms of your work, your working folks and stuff. How about for yourself? You said that your specific goals, do you have something in mind where you want to lead the departments, or?
Well, I guess, you know, the biggest goal is to make sure that we provide the best remarkable experience for our patients every day. So that's my goal, in making sure that we are doing that. And if there's any barriers, if I can assist with barriers, then that's what I'm there for. And so far, you know, everyone has been wonderful. The managers are great, the staff are really great, and from what I understand, we do our roundings every day now, and I go and talk with patients, and we are providing remarkable service. The patients love the clinicians, and I mean, even down to EVS. And so
let's talk a little bit about that rounding process. Tell me more about that.
Currently, the leaders of each department are rounding daily on the floors to talk to the patients, make sure that they're getting what they need, and if there's anything that's going on that we can assist with during the time that we're there talking to the patient or family members, then we try to address it right then. And if not, then we'll go to like the nurse's station and say, well, patient in room 100 is requesting this, can you go see what they need?
Right.
So it's been a very, very rewarding experience.
How do the patients react? How do they
Because when we go into the room, because we're not the nurse or you know, someone that they're used to seeing, we let them know that we're leaders of the hospital, and we're just coming in just to make sure that you're having a comfortable stay and that all your needs are being met, and if there's anything that we could do to assist, to please let us know. And they're very welcoming. But most of the comments that we've gotten is that everybody there's just been providing the service that they expected.
Well, before we wrap up, is there anything we've left out that you want to make sure our viewers know?
I would like everyone to know that the staff and the physician and the nurses at Novant Health Brunswick Medical Center really want to make your experience remarkable, and they're doing the best that they can to make sure that you can get in and get out and get back home as quickly as possible.
Well, that's great. Well, thank you so much for joining us on the show today, Desiree. It's been a pleasure to have you, and I look forward to having you back after you've been here a while and see how it's going.
Okay, well, thank you so much for having me.
You're quite welcome.